Live from Studio A, somewhere inside the great state of Kansas, it's Leadership Late Night, sponsored by the Kansas Leadership Center. I'm DJ AJ, back to support my dad because he's paying me in gummy bears. Joining my dad tonight, the CEO of Greenwood County Hospital, Sandy Dickerson. Now, your host, and a man who's had quite a few gummy bears himself, DJ Whetter.
Good evening, everyone, and welcome to Leadership Late Night. I'm your host, DJ Whetter. I'm not going to lie, the struggle is real here in the Whetter household. We're on day 23 of the stay-at-home order in my county, and we're on day 64 since my last haircut. Now look, of all the things going on in the world, does it matter that I can't get a haircut right now? Absolutely not. But let's take a look at the visual evidence. It's not good. This is my hair when I woke up this very morning before I used an entire bottle of gel to try to get it to move in some similar direction that resembles a hairdo. Look, the last time my hair was this long was in college, and at that time I had friends who had ab muscles. Today, not an ab or a puka shell necklace between us. That's how long it's been. And let me save my wife a post here on Facebook. I didn't say I had ab muscles, but I had friends that had ab muscles. I'm off subject though. Here's the point. Let's not pretend that being able to do something reasonable with whatever the good Lord gave you up here doesn't matter. It just does. Unless you're a member of a boy band, civil society in most cases requires you to keep it together up here. Let's use me as an example. This guy has a lovely time at the father-daughter dance a little more than a month ago. This guy would be asked by the principal to never pick his kids up from school again because he's scaring the other children. This guy is the best looking man by far in this photo, even though it's his brother-in-law's wedding day. This guy wanders into weddings he wasn't invited to and is removed by security. This guy spent most of 2014 and 2015 being asked if he was, in fact, Royals World Series champion Alex Gordon. This guy gets mistaken for Sideshow Bob from The Simpsons. This guy allowed through airport security. This guy definitely getting stopped by TSA. This guy loved by puppies and allowed to hold other people's babies. This guy watches his own dog and children leave the room when he enters.
Dad, enough. We get the point.
Really? Because I had a few more.
No, I think we're good. I can't look at that photo anymore.
Okay, well, fine then. But seriously, this guy takes artsy, offset photos with his wife near brick walls with one random light. This guy looks like he shocked himself trying to change the light bulb in this photo. I'm not going to tell you how long it took me to do that poor photoshopping there. Anyway, this guy got married 12 years ago this very Sunday. Happy anniversary, Lori. And this guy, well, he's probably still married to the love of his life because what he doesn't have in the looks department, he makes up for with charm and charisma.
Now are you done?
Yes, now I'm done. I had to get that last one in because I haven't gotten your mom anything for our anniversary.
So you went with the shameless plug on Facebook Live?
Don't worry about it. She's going to love this. Now, I hear you asking, couldn't you just buzz your head? Maybe if you shaved your beard, you'd look better. Those aren't the right questions to ask. The real question is, what does any of this have to do with leadership? And to that I say, I don't know. What do you think it has to do with leadership? And that, my friends, is called giving the work back. Boom. Leadership lesson. DJ AJ hit the beats, I'll hit the desk.
Got it, Dad.
All right, thank you DJ AJ. As always, good to be back with you all back here at the desk. It's a rough night here at Leadership Late Night. I'm not going to lie, aside from the hair, we're going up against Disney Sing Along Live. I mean, come on. What? I don't know what you want me to do here, but glad to have an audience out there. Appreciate those of you watching because we've got a great show this evening. We're going to have a great discussion with the CEO of Greenwood County Hospital, Sandy Dickerson, And we're back to a segment that was pretty popular last week, a little something we call social ding-dong distancing. We'll get to that in just a moment. First, as a reminder, get in on the chat. Let us know where you're watching from. Let us know what's going on tonight. I'm missing haircuts. Let me know the silly little thing you're missing because this pandemic has been going for 4 or 5 weeks now. Look, there's signs of progress out there. And again, we try to have some fun on this show because times are tough and we need a break from things. But as always, just want to say thanks to all the people doing work out there, really keeping this country and this world going in tough times, the essential workers. We're thinking about you. And hopefully tonight we can have a little bit of fun, a little bit of conversation, and talk a little bit of leadership. But look, before we get too heavy into leadership, before we get heavy into a discussion about rural hospitals and this pandemic, it's time for another episode of a little something we call social ding-dong distancing. Enjoy. Welcome to another episode of Social Ding-Dong Distancing. Addison, where are we?
Back at our house.
That's right. We got in the car, drove around the neighborhood, and came right back here. Why?
Because it's too cold and rainy to go over to someone's house.
But we still wanted to do some social ding-dong distancing. So we're going to use our computer instead. Right, Parker?
Yep.
Blooper. For this episode, what supplies do we need?
A computer! And a super long microphone.
A super long, broken, fake microphone. We'll work on that. We're going to call some of our best friends the Boxberger family. So normally we'd be outside your house, but it's way too cold. Trip and Reese are Addie and Parker's friends, and Adam is my good friend. We got this other screen today, but we can still use the extra long microphone and we can hear you guys, okay? So can you guys show me how you'll talk into the microphone?
Hi!
There you go. Now you're talking. Now we can hear you. Good.
What did you do over summer break?
You mean like last summer? Or you think like right now it's summer break? Basically right now.
We are basically playing with Kemper, playing soccer, and watching TV and staying inside, I guess.
You're riding a lot of bikes too, right?
Yeah.
Yeah.
That's good. Who's Kemper?
My dog. She's really silly. We got her about a year ago, maybe.
Feels like a year ago, but it was like 2 months ago.
Yeah.
If you could turn into any food, what food would you turn into?
A carrot. I would turn into pizza.
Yeah, it might be better to be something that wouldn't get eaten. You know what I mean?
Broccoli.
That's a good one. Yeah, nobody would eat you if you turned into broccoli. I think that's a great call. What has been the most fun thing you've done since we've been on this stay-at-home thingy?
Play in the bounce house.
You have a bounce house in your house?
In the
Yeah.
Why have I not been invited to jump in your bounce house?
Yeah, you're too big.
I'm
No,
too
he's
big?
old. There's an age limit.
The weight limit is 150 pounds, I think.
150 pounds. Okay.
200
How much do you think I weigh, Trip?
180.
Nailed it. Right on the dot. Adam, how's it going working at home with 2 amazing children?
It's all right. I think my amazing wife is doing most of the school at home and everything else there. So
Yeah, he's doing that.
I have been locked up in my office and trying to work as normal, but yeah, help out wherever I can. But it's mostly my wife doing all the heavy lifting here.
Trip, did you say your dad's been doing nothing?
Yep. He's just been hanging around in his office on calls and eating candy.
I wouldn't say that.
Well, that part is absolutely true.
Oh, we're down to just Reese. Hey, Reese.
And a foot.
This is deteriorated. Well, we missed you guys.
Yeah, we miss you guys too.
We miss you guys too.
The 3 of us are going to go to Jack Stack here in like 15 minutes.
What?
We're still recording him. Let's see if we get anything
Oh.
good.
Hey, jerks.
Hey, old man, when you get off the Zoom call, you hit end call. Look, that's a leadership lesson and a life lesson. When you get off the Zoom call, hit end call. Unfortunately, I've seen it over and over since we've started this social distancing thing. There is a severe gap between those who understand how to use technology and those who don't. And my good buddy Adam is one of those who does not understand how to use technology, unfortunately. Well, I hope you enjoyed that edition of Social Ding Dong Distancing. It's time to take a turn here in the show and get down to business a little bit. Tonight, we've got an interview with a guest out of Greenwood County. And Sandy Dickerson will be joining us. She's the CEO for Greenwood County Hospital. And we're going to have a discussion about COVID-19 and what it means for a rural community to really hold to purpose, to find ways to come together in tough times, but to also understand what it means for a county to really keep the cases down in this rural setting. Because if any cases show up in some of these areas, the limits will be tested of the healthcare system very quickly. It's a fascinating conversation, and I'm excited to welcome to the show our guest tonight, Sandy Dickerson. Sandy, welcome to the show, and thank you so much for joining us. I wonder if you'd just take a few moments to introduce yourself to the audience and tell us a little bit about the work you're doing.
Right now is kind of crazy for us. I mean, like most hospitals, we're preparing for potential patients that could come to us. We've had one COVID-19 patient in Greenwood County, but they haven't been at our hospital at all. We have no idea what the future holds for us in relationship to that. So we've been doing some preparing here, working with our community partners to make sure that if we get any patients, we'll be prepared.
Situated 2 counties and more than 60 miles east of Wichita, Greenwood County only has one confirmed case of COVID-19. And the patient was a healthcare professional working in a neighboring county who immediately quarantined because of cases at the facility she worked in. That quick action is key for communities where healthcare access is available, but limited should a large number of people seek help at the same time.
In a hospital this size, if we got very many, and I'm talking like 6 or 7 in our hospital, that's going to present some challenges to us, because we already have like 6 people admitted to our hospital right now who don't have that. They have like regular everyday issues that they're here for. Some swing bed services, which are rehab type things. Then you put on top of that 6 or 7 people who are having some significant breathing issues. That's going to present some challenges. I mean, it's a 25-bed hospital, and 14 people admitted to our hospital is pretty busy.
And understanding that reality has meant years of preparation have gone into being ready for a situation like this.
Have a plan in place. The time to prepare is before it actually hits and not after. Be prepared with your community partners for that, because we are a 25-bed hospital, but we can go up to 45 patients in our building. Because of the number of rooms we have, we can put 2 patients per bed or per room, but we don't have 45 beds. So where can we get some? How can we make that happen? Well, the time to be asking that is before, certainly not when they actually show up. I mean, and we need those beds, and we don't have any idea where we can get them.
Aside from equipment, Sandy is reflecting on the trust that exists between the county government and the hospital in this tough time. It's a trust that wasn't always present. Sandy is not originally from Greenwood County, and she inherited a system that wasn't always trusted by its residents. That meant starting the long process of rebuilding that trust.
You know, the relationship between our hospital, we are a county hospital. But the relationship between our hospital and the county itself has not always been positive. So over the last few years, we've been trying to develop a relationship with them that is more trustworthy, um, more collaborative. Um, it's been a long process to do that, to where we can now call up individuals that work in the county and say, hey, we need your help. Because before there wasn't that relationship, to be quite honest. Um, they didn't trust the hospital. They didn't trust the people who worked here at all. And um, there was a very strained relationship. So reaching out to them and saying, you know, we're here and we need your help has been the valuable work that has taken place before today. So we're talking 2.5 years of saying, hey, how about we get together and talk about some things? Hey, can I just have a cup of coffee and talk about how we can work together?
You're naming those distinctions between authority and leadership as well, right? You bring so many years of expertise to this work, and you're an outsider in a community. And so to build up that stakeholder side, to be able, the story being told about you and the hospital may be, well, it's a group of outsiders running it. And it sounds like you put some work into that piece of it, to know that it's beyond just expertise and ability. There's more work to this.
When I first got here, the story that they were telling about the hospital was not a good one. It was um, a very segregated piece to the community. Everybody acknowledged that they need the hospital, but they certainly didn't trust the hospital.
Wow.
I mean, there were financial concerns and issues that had been played out in the newspaper for months, even a couple of years, where they just did not believe that this hospital was going to be okay and here for the long term. So people were actually taking their business somewhere else. I don't want to establish a relationship with a place that may not be here in a year.
Yeah.
And it took some work to get that to change.
That change in attitude will be tested now. The hospital's biggest concern is treating patients who are vulnerable to COVID-19 because they have other underlying health issues that require them to seek care regularly. Finding ways to continue to meet patient needs without coming to the building will be a new edge for Greenwood.
If you're somebody that lives in our community that has a chronic condition, so diabetes, a heart problem, anything that would require like ongoing medical care, that makes you more susceptible if you get the illness to possibly needing hospitalization because you are at risk, is how they define it. So those people don't want to come anywhere near the hospital, because if in fact it is in our community, then those people would be here. And they just are afraid of coming up here. So we've had to think about how can we provide a service to the community that would actually help them in this time, because eventually not seeking that medical care is going to create problems on down the road, problems we're going to have to deal with. So we've been trying to think outside the box and provide that care where the patient can get it without actually coming to our facility.
In the midst of this tough work, however, Sandy is able to look back on what having a solid relationship with the community really means.
Extremely valuable right now. We have community members who are asking, how can I help? What can I do? Our community has come together in a way that um, maybe they wouldn't have otherwise, um, where people are asking, what do you need? How can we help? Where they're actually helping their own neighbors with delivering food to people who are at risk and can't get out, um, staying home when they're supposed to. I mean, the fact that we only have one patient in this community is proof that people are doing what they're supposed to be doing.
I don't know what your feelings are as someone who works in a hospital, but I'm a big believer that laughter is at least one like medicine we can all provide each other, and finding a way to smile and laugh. And I'm wondering if there are things that are still making you laugh right now, or what, what is making you laugh in this tough time?
Yeah, there are things that make me laugh. The people here still have a positive attitude about what's going on around them, and they find ways to laugh, to share things that are funny. Um, we do things here at the hospital to try and encourage an upbeat, positive attitude, um, because there's just so much to worry about otherwise. And and if that's all you ever do, it's going to look pretty bleak, and it's going to be pretty hard to get through a day. So yeah, I find reasons to laugh. I find things to make me smile, and um, friends and family make me laugh. They make me happy.
Thank you so much for joining us.
All right. Thank you.
Well, that was Greenwood County Hospital CEO Sandy Dickerson that just joined us on the show. And I think just an interesting conversation that really highlights a few things. And I think Jeff Mendel said it well, weighing in tonight all the way from San Francisco. His takeaways: prepare way before, align with partners, repair broken relationships. Yeah, three themes that were key in what Sandy had to say this evening. I just thought so interesting that as she reflects in the midst of a crisis, and yeah, one case, I get it, one case, but to have 6 or 7 hospitalizations likely means 50 cases in that county. And if it gets to that point, they're maxed out in their county hospital. All right, so that's the reality of what stay at home means. And to have a county that understands what it means to take care of each other in that county has been an impressive story. Doesn't mean there won't be more cases. It's a virus. Things are going to happen. But the fact that there is a relationship between the county, between the hospital, and its people seemed to really be telling an amazing story about the work being done down there, and all about repairing relationship over the last 2.5 years in preparation for who knew what. But it happened to be this pandemic, and I think that's super, super interesting. We're going to get to a few more comments from you all out there, so be sure to weigh in on what you're seeing, what's resonating with you about the conversation with Sandy. And Rob Olson weighs in, and he mentioned some protests going on in Michigan and around the country today that basically say open the country back up. People gathering and saying enough is enough. We're tired of staying at home. And juxtapose that for me a little bit between that and what's going on here. And Rob asks, is that a lack of leadership? I don't know, but I think it says something about authority for sure. And we can get that discussion going. It might be a great discussion for the after party. Juxtapose what we're hearing in Greenwood County, which is, yeah, it's not easy. It's not easy to stay at home, and yet we know it matters, so we're doing it. And we've got relationships where we're able to hold each other accountable, and what we're seeing in other parts of the nation where that may not be the case. Look, I don't know what the right answer is, but I do know it's interesting to look at all that. Before we get the conversation going, a reminder as always, if you enjoyed this story tonight with Sandy, you can read more about her in the Kansas Leadership Center Journal. The newest story out right now is a big moment arrives for rural grocery stores, but will the sales last after COVID-19? So for that story, for more on rural healthcare, and for some just amazing reporting that's been going on by the Journal staff, Chris Green, managing editor, and his team. So impressive during this time. Be sure to check out klcjournal.com and read some of those stories. They're updating that all the time with new information, and just some fascinating stories continue to come out from that work. Well, let's get back to this conversation at hand then, and I want to look over here at the chat window, and Amy weighs in. 25-bed hospital puts in perspective the challenge that while there may not be massive numbers like NYC in rural areas, it wouldn't take that many people for the hospital to present real problems. Yeah. You know, I was talking, and I think I've mentioned on the show before, but it bears noting that we have some relationships with partners that work with communities of faith across the state and multiple states. They're, synods, districts. And there's been pushback in communities of faith. Why can't we meet? There aren't any cases here. Well, I hope tonight's story highlights one of the interpretations of why you stay at home before the cases come. Because in some of these rural areas, the access to healthcare means if we don't do it now ahead of time, our NYC numbers, as Amy just said, it's not thousands, all right? It's 6 or 7. That will max us out on what we can handle in intensive care units, in just beds in a hospital. We could have more beds in there, as Sandy said, but we've got to find a way to get those beds. They have that if needed, and they're not set up every day to be more than a 25-bed hospital. It certainly puts that in perspective. Kevin Baumhoff weighs in. Thanks, Kevin, for being on the show tonight. Diagnosing the lack of trust related to financial issues can lead to strategies such as transparency, personal relationship building, admitting our piece of the mess, and taking responsibility to improve. Yeah, it's not something we've talked a lot about on this show so far, but this idea that we are all a part of the mess, all right? I don't see it much at the governmental level at times. This idea that I am a part of the mess or we are a part of the mess. I'm not naming names. I'm not taking sides. I'm just naming that I think there is something about being in politics and the timelines and the need to get reelected that suggests to take blame and to say, if I'm a part of the mess, we can be a part of the progress, sometimes doesn't add into the equation. And what I think that leads to, it leads to a situation where people aren't, they have to take sides, right? They have to choose a side. And this is not a time to choose sides. We won't find out until years from now what the reality of this situation is. And I think the story tonight highlights that, I think the best thing we could say after this was all over is we were too cautious. That would be amazing. We were too cautious. We did way too much. That would be a sign that we made a lot of progress and perhaps lives were saved. So it's just an interesting balance. Amanda Sabula on the chat tonight. Good to hear from you, Amanda. And she says, it's like Kevin says, the traffic is bad. Oh, wait, I'm driving in that traffic. Yeah, that realization that when you're ticked off at traffic, you're a part of the traffic as well. And we've got to give credit not only to Kevin, but Kevin's wife, who I believe once pointed out to him, it's amazing that you can be in that traffic and yet not be a part of it, right? The realization we are a part of the mess. Well, I'd love to continue this conversation. What's our part of the mess? What does it mean to be a citizen right now? What does leadership look like? What should authority look like? How do we offer protection, direction, and order? All those conversations continue on in our Zoom chat room. I hope you'll join us. We'd love to get a conversation going there. Until then, it's time to wrap up the show tonight. This half hour always flies by. I hope you have some takeaways for the evening. Thank you so much for joining us on Leadership Late Night. And as always, DJ AJ, go to bed.
Good night, Dad. I'm going to bed. But you should go check out Dad's after party. And now, moments of hope.